few months ago, we discovered something amazing about your brain. The evidence for what we found has been right in front of our eyes for millions of years, but no one ever figured it out because no one ever used optics like ours before. We use Stanhope lenses, little magnifying glasses invented in the 19th century, and we put them in a planoptic or fly's eye array, like the compound eye of a fly. A Stanhope lens works like a pinhole. Looking through it, you see an image in focus at infinity. No matter if you're nearsighted or farsighted, it's in focus. That's because the overall image is smaller than the diameter of your pupil, so the focusing mechanism of the eye does not engage. The image passes through your eye as a parallel ray, much like a collimated laser beam, but a full spectrum, complete image, and it images in focus on your retina. The difference between a good Stanhope lens and a pinhole is that the Stanhope is as big as it can be while still smaller than the pupil, which not only gives you a larger, more detailed image, but also cuts back on the chromatic and spherical aberrations that make a large portion of the light from a pinhole appear out of focus. We make very good Stanhopes and combine them with software so that we cut that aberration and distortion down to just about zero. We're pretty good engineers. And why did we do this? We didn't think we'd discover something new about the brain or the eye. We thought we understood what we needed to know. We wanted to place an array of Stanhope lenses in front of an array of coordinated views of an image to show the eye a light field. Light field imagery was invented over 100 years ago, and lots of people use light field imaging arrays these days to capture and display 3D images. We made our light field array out of Stanhope lenses because we wanted to show you 3D images in full focus at infinity and thus make AR and VR glasses brighter, simpler to manufacture, lighter weight, and solve the Vergence accommodation disparity problem that gives people headaches and nausea. And we called what we invented a foveal display because we thought we wanted to aim all our images at the fovea, where some 90% of our visual acuity resides. But when we studied the images we projected into the eye with our Stanhope planoptic arrays, we found out that it was much more interesting to aim our focused, separate, and coordinated images at peripheral areas of the retina. When we do that, even when we send no light at all to the fovea, we see the very same image as if we did just aim at the fovea alone. And the image is bright, in good focus and good resolution. So here's my big reveal. The visual cortex of your brain combines multiple separate images perceived by different parts of a single eye, just as it does the two distinct images seen by normal, healthy, two-eye vision. It makes a single stereo image. We still have brains that can see what a fly's eye sees, millions of years of evolution later. Now, we can do a lot with that discovery. We have patented a whole series of software products we can build on one basic hardware platform. We're going to transform vision health and eye and brain diagnostics for a vast number of conditions. Our first go-to-market product is outrageously important. We give sight to blind people. If your central visual field or some part of the peripheral field is messed up or missing because of macular degeneration, your brain will fill in the missing parts of what you are looking at from all the other images our optics show you at the same time. In preclinical trials at Lighthouse Guild in New York City, patients with macular degeneration have had their reading ability increase from twice to infinity. Infinity meaning they couldn't read at all before and can read looking through our prototype. So we are going to market in 2024 with the world's first low vision aid that actually provides sight where people had none. Like all low vision aids, we don't need FDA approval, and our glasses will be lightweight and comfortable to wear for long periods, unlike virtually all existing VR and AR glasses. We know exactly what we're building and how to sell it because we've attracted a great team that knows the market very well, and we have lots of advising, brilliant physicians and scientists who strongly support our effort. And we can build it cheaply because having started out to solve all the problems of 3D displays and AR and VR headsets, we know how to ride on top of all the technology in those fields. There are hundreds of millions of blind people in the world that we can give sight to. That's a mission, and it's also a multi-billion-dollar market. Join us. Thank you.
Okay. Virtual round of applause for Neil. Neil's on screen now, so judges, please feel free to ask Neil some questions.
Hello, this is Felix Lee. I'm wanting to understand how much testing have you already done?
Well, we've done a lot of testing with, internally and with a core team of advisors, retinologist Dr. Susan Malinowski, optometrist Brian Walensky, the head of research at Lighthouse Guild, whose name is Dr. Bill Seipel. He's also a professor of ophthalmology at NYU. And Bill himself has macular degeneration, so he understands precisely what we're doing to what he sees, and we have created vision in an area of a central visual field where he's lacked vision for many years. In terms of the preclinical trials, so far we've got about a dozen qualified subjects, and routinely every single one of them had their sight improved by a factor of from doubling to, call it infinity, because they couldn't read at all before. And with our test that we use, which is a modified Bailey-Lovie test that Dr. Seipel and I developed together, they're able to read where they couldn't before. So we're continuing on with the preclinical trials. We expect to have about between 30 and 50 within another 2 months. And that's so far who's been able to use it.
Thank you. Okay, perfect. Do we have a follow-up question? Kelly, go ahead.
Thank you. First of all, it's wonderful to have the history. That's where innovation can come from, something from the 1900s. So this is really commendable. And I hope that you are also wearing the visual aid, right? So my question, really, joking aside, my related question is that how heavy is it, in terms of this solution? My other question is that, in terms of this, you talked of macular degeneration, and there's no FDA approval, so there's no particular sort of label associated. However, as you know, there's a major question about patients undergoing LASIK. Sometimes they have this ring effect, and the peripheral vision is affected. Some have very challenging situations during night driving. Have you thought about this particular patient cohort beyond macular degeneration? Thank you.
So to address the first question first, there was an image there of the first generation product that we expect to come out with next year. It actually will look less clunky than that picture. We figured out a way to make it lighter weight. It'll probably weigh in at about 1 pound, maybe 3/4 of a pound. That's too heavy, and also it's a VR-like device. In other words, all that you see through that is the video image. So it's something that would definitely be in demand to use for reading, watching television, interacting for a couple of hour stretch with children, grandchildren, but not something that I would wear around all day long. And so we also showed an image of what we expect our second generation device to look like, more like normal eyeglasses. That will be a fully AR device where the lens tiles will project the images from the what's now like rims of eyeglasses from the extreme periphery of the field of view, and the middle section will be maybe a corrective lens for myopia or any other kind of lens, could be sunglasses, whatever. And so that should be just a little bit heavier than today's normal eyeglasses. Got to be room in there for battery, for some processing, but all that stuff is shrinking. Part of how I know this is that our contract manufacturer is Qualcomm, and their 50% owned subsidiary, Thundercom, that actually does the manufacturing. We're riding on the wave of 90% of all the AR and VR glasses are based on this. So we know all the technology that goes into this, and we're not hardware manufacturers. So they'll do the contracting. Eventually we'll license our technology to people who make eyeglasses. It'll go wider, it'll be much lighter in weight year after year. So that's the first question. The second question is, every time I test this with people who are not qualified subjects, and we've tested a lot, who have just widely disparate problems in terms of their vision, I find out so much more about what we're able to do. And I wasn't able really to describe what we're eventually going to be able to do in terms of diagnostics. And this gets a bit long, I'm sorry, but we're able to project parallel rays to the retina, which means we get white light with pinpoint accuracy, almost as pinpoint accuracy as you get with coherent light. So we are actually going to be able to map the retina with extreme accuracy. I could explain how that works, but too much time, and really rival optical coherence tomography with a different sort of light going deep into the brain with the infrared that we get out of a typical inexpensive display. So long answer to say there's a lot we're going to be able to do for a lot of other conditions. A little bit addendum to that, I got motivated to do this in the first place because my father went blind from glaucoma. I haven't been able to find anything we can do for glaucoma yet. So we'll see.